Whenever I talk about a nasty disease like cancer, you'll probably look at yourself and say, well, that's not me. I'm not going to get that. But here's a sad reality. Cancer is the #2 killer of people in developing countries. So therefore, there's a high likelihood that you could not only get cancer and die from it, there's a high likelihood that I could get cancer and die from it. So if we do not want to fall into the statistical norm, we have to start making changes today. And it all starts with the food that you're eating. So in this video, I'm going to show you the foods that you can eat to avoid cancer. Hey Wellness Warrior, I'm Dr. Zyrowski, and the top cancers that you have a high likelihood of getting one day are going to be cancers like breast cancer, colon cancer. Colon cancer is actually one of the fastest growing cancers today. This is why I do so much work with individuals in the way of gut health, because it is a disaster of a problem and nobody's helping anybody. So colon cancer, stomach cancer, prostate cancer is also a big one that seems to just keep getting worse. Skin cancer, and also lung cancer. And it's like when I look at these cancers, I can look at every one of them and I can go, I can tell you a story of a patient I've worked with in the past 30 days who is dealing with some of these cancers right here. So the reality is it's happening all over the place. It may not be a reality for you right now, but the fact is we have to make changes so it doesn't become our reality. So when we think of these different cancers, what we want to do is start eating foods that have been proven in the research to counteract them, okay? The foods that we're going to talk about help decrease inflammation, they help decrease tumor growth, and they really help in acting as a preventative when it comes to cancer. So let's talk about some of the different compounds and I'll correlate them with the food that they're in. So the first one is going to be sulforaphane, okay? Now, where could you find sulforaphane in your diet in order to prevent and avoid cancer? Well, you're going to get this from your cruciferous vegetables. So we're thinking cabbage, kale, broccoli, leafy greens. So this is where we can get sulforaphane in order to help prevent cancer one day. So really stick to your cruciferous vegetables and make sure that you're eating these regularly. This should be something as part of a daily food regimen for you. Not something you eat once a week, but something that you eat daily. Now, polyphenols is the next one, okay? Now, this is something that also has been proven in the research, as all the different compounds that we're gonna talk about here are. Now, polyphenols can be found in a couple different places. One of the highest places you'll find polyphenols is going to be in cloves, okay? Now, you're probably not walking around eating a lot of cloves every day, but some common places that you'll find polyphenols is going to be apples and also berries. Now, that moves us on to anthocyanins. Now, this is something also very, very good in preventing cancer, and you're gonna find these in berries. This is where you're gonna find the highest level, okay? So if we're thinking blackberries, we're thinking blueberries, we're thinking these micronutrient dense, low glycemic fruits that are very good for us. So I want to make sure that we're getting lots of this anthocyanin in. Now the next is going to be beta carotene, and I know that you know where this comes from. This is coming from your carrots, okay? So eating carrots is actually very cancer preventative as well. Omega-3s, okay? You know what omega-3s are. Many people supplement with omega-3s because it helps them feel better. It decreases inflammation, does a lot of really good things for you. But where can you get omega-3s in your diet? Because I'm all about supplementing with them, but I also like to make sure that I'm getting them from a food source. You're gonna get your omega-3s and your DHA from fatty fish, salmon, mackerel, anchovies, sardines, and herring. Those are gonna be the best sources of omega-3s for you. Now this one's kind of a funny word, pedunculin. Now where could you find this weird compound in your food? Well, this is actually gonna come from walnuts. You may have heard that walnuts are like this amazing cancer preventative superfood that you can eat. Well, that's because they have this in it. So walnuts are something you definitely want to add to your diet. You're also going to find this in like your berries as well, but walnuts have a high amount of them. And this is why when you hear of prostate cancers and breast cancers and all these different cancers out there, you always are seeing eat more walnuts because they're also loaded with like omega-3s, okay? So I wanna make sure we're getting plenty of that. Now, what's the #1 bonus tip that we have to really focus on if we want to prevent cancer as well? This is going to be fasting, okay? Thomas Seyfried, who is a neurogenetics specialist, he is a neurobiochemist, and he also is a specialist in cancer. He wrote a book called Cancer as a Metabolic Disease. And one of the things he cites throughout the entire book is how important it is to use fasting. It's easy to use, it's non-toxic. He gives a million reasons as to why it is so cancer preventive. So when we talk about not only preventing cancer from the way of eating healthy foods, we also want to think of how we can improve our lifestyle. And I know that I talk about fasting a lot, but I can guarantee you that you probably haven't been keeping up with it well. You probably have been slacking on it a little bit, and hopefully this will serve as a great reminder to kick off intermittent fasting again. Kick off some 24-hour fasts in your life, some 48-hour fast, and maybe even a 3-day fast would be in your future. So if it's something that you've been slacking on a little bit, start fasting again. You know, recently I was working with an individual and they said to me, you know what, I started fasting again based on my advice, and it's working so well for me. And it's kind of interesting because this individual had been fasting almost 5 years ago, loved it, was doing great, and then he just got out of the habit. He developed a metabolic disorder. He developed all kinds of problems and was suffering greatly. And when he implemented fasting back in, he was like, why did I ever stop, right? So if you're in that position, you're thinking to yourself, well, why did I ever stop fasting? Go ahead and jump back into it, eat the right foods. And if you love to learn about the topic of cancer, I think you'll really like this video next.